In this slide, I'm going to review very, very quickly, I know it's going to be fast, kind of the overall evaluation process and what happens. So initially, when you see a student who may be struggling in the classroom, you can't immediately say, I think this kid has a disability. In fact, never should you utter the words, I think your child has X disability, because as teachers, you don't have the expertise or the qualifications to be diagnosing students. But when you do see a child struggle, first what they're going to want you to do is response to intervention, or RTI. So they're going to want you to put in some support systems and try some new strategies to see if maybe the student is just delayed or behind, and maybe with some strategies they can catch back up or they can learn the material as needed. But if you continue to see a student struggle, then that might mean that we might evaluate and suggest testing. So if that's the case, then the educational diagnostician will talk to the parents about a full and initial evaluation. And so what that means is that they're going to evaluate the child in many different regards, but the parent does have to sign off on testing. So the parent can say, yes, I want them tested for learning disabilities, but I don't want them tested for ASD or emotional disturbances. When my child was getting tested, I just signed off on every test possible. So the educational diagnostician and other school professionals will administer evaluations. So like IQ tests, achievement tests. The child psychologist will evaluate a child for ASD or emotional disturbances. The speech therapist may be involved, or occupational therapist may be involved. So there's several evaluation processes that can happen. But that's kind of the process that they undertake for that evaluation that occurs over 45 school days. What they're trying to determine after they do that full and initial evaluation is if they qualify, do they have that educational need for a free and appropriate public education. So you're going to meet as an ARD committee, which is admissions review and dismissal, and you're going to go over the results of the FIE. So the members of the ARD committee are the educational diagnostician, the administrator, a general education teacher, a special education teacher, the parent, and then any other support, so maybe the speech therapist or occupational therapist. So they're going to review the information, and they're going to decide whether or not the student is qualifies, or the educational diagnostician already qualifies under the guidelines for admission into the IDEA special education programs. You're going to review all of the findings and decide on the types of accommodations the student may need. But every year, so the ARD committee meets every year to review the qualifications. It's possible the student may be dismissed from services if they've met goals, like speech goals or occupational therapy goals. Then the ARD committee may decide to dismiss that student from those services or from special education altogether. But you do have to meet at least one time a year. So one of the things they're going to discuss in the ARD committee is the IEP, or the Individualized Education Program. It's very detailed. It's going to go over what the student's disability is, so how they qualified. It will go over any kind of accommodations needed for the STAR test and accommodations that happen inside the classroom. They're going to look at the student's goals. So the special education teacher will set goals for the students for the following year. They're going to look at any assistive technology that may be necessary, or maybe behavior intervention plans. So it's actually quite lengthy making all of those decisions, and then decide, who is going to administer some of those plans or programs. They're also going to decide about the least restrictive environment. So they're going to decide on where do these services take place: inside the general education classroom, inside a special education classroom. Do they need to be in a self-contained classroom? So they want, according to the law, they want special education students in the least restrictive environment. So they want students with disabilities interacting with students who do not have disabilities as much as possible. So that's where we see the big inclusion movement that's happened. The other thing they're going to decide is specially designed instruction. So if the student qualifies under IDEA, then that means, again, that there's an educational need. So they'll decide on that specially designed instruction, and again, where the student receives it. If they'll be pulled out to receive that education, or if the education will be pushed in. And again, they'll also decide on a behavior intervention plan if needed. So in that case, it would talk about what types of behavior interventions may take place.